Many countries are still experiencing intense transmission, and the situation in India is beyond heartbreaking.
In dangerous times like this, the best bet one has to survive this pandemic is by staying aware of the COVID-19 symptoms and seeking healthcare early. So let's take a quick look at what these symptoms are and how do they develop. Each lung has separate section called lobes. Normally, as you breathe in, air moves freely through your nasal cavity to your trachea or windpipe and then via bronchioles reach tiny air sacs called alveoli. These tiny air sacs are flexible, springy and filled with blood vessels. When you breathe in, each air sac inflates like a small balloon, and when you exhale, they deflate. Oxygen from the air you breathe passes via these capillaries into larger vessels, which then transport it throughout the body. Reverse action takes place and carbon dioxide is removed from your body. Your airway catches the most germs in the mucous linings present in the trachea, bronchi and bronchioles. However, in a healthy body, the immune system attacks and destroys these germs. But now, if your immune system is weakened, as it is in the case of a coronavirus infection, these viruses can overwhelm your immune cells and your bronchioles and bronchi become inflamed as your body fights against these viruses. This inflammation can cause your alveoli to fill with fluid, thus making it difficult for your body to get the oxygen it needs. This can cause lobar or bronchial pneumonia, whose various symptoms were noted in the initial stages. Now, according to the latest reports of the National Institute of Health, the double and triple mutated variants of the novel coronavirus has been showing several other oral symptoms like xerostomia or dry mouth, a condition where the mouth doesn't produce enough saliva. Oral lesions. An oral lesion is an ulcer that occurs in the mucous membrane of our mouth. Lesions occur when the virus attacks the muscle fibers of our oral linings. COVID tongue, a condition where the tongue appears white and patchy. This condition occurs when the salivary gland does not produce enough saliva, which usually protects the mouth from bacteria. Change in color of tongue. The infection may also cause mouth irritation and swelling. Eye watering, pink eye or conjunctivitis. Other complications observed were diarrhea, vomiting and stomachache. And in more severe cases, patients went into respiratory failure. Please ensure you keep the following medical equipments handy. According to Dr. Rajiv Malik, IMA, had the patients identified their symptoms and had consulted their healthcare professionals on time, 60 to 75% of COVID deaths in Delhi could have been avoided. However, since this is the time for seasonal change and fever and cough are a common symptom, one needs to be more cautious. If any of your symptom is persistent for a while, please seek medical care early to reduce the risk of developing a more severe infection, and be sure to share your recent travel history with your healthcare provider. Don't forget to share your recent travel history with your healthcare provider. Thank you so much for watching, and if you have any more queries, do comment them down below. And if you found this video useful, don't forget to share it with others. #stay safe and spread awareness.